I'm excited. I'm very curious about how I'll be after the surgery. I'm excited. I mean, I want to see the aftermath. Hopefully the surgery will go well. Thanks.
During the shaping, we implement my unique technique. We avoid any cartilage cutting or extraction processes. We keep the cartilage intact while we shape it. We will perform shaping by observing it directly and stitching it. In these shaping procedures, we offer the most natural results to you and our other patients. Because we don't cut cartilage, we can create adjustments that are very similar to natural formation. Thus, we really get very natural results. Inside the ear, we must create folds resembling the letter Y, because the natural anatomy is structured that way. The moment we create the Y-shaped fold in the ear, most people or no one will understand that your ear has been changed. They will not be able to tell that your ear was done later. When we finish shaping, we will cover the incision behind the ear with concealed stitches. There will be no need for stitch removal. These stitches are approximately, the parts of the knot will be exposed. They will dissolve and drop off in 3 weeks. In the method we use, there is no necessity for a bandage behind the ear. It's not done. When you have your ear open 2 days later and clean behind it, just be gentle while washing in the shower afterwards. Cleaning will suffice. Post-surgery, we will give you antibiotics and pain relief medication. If you use the antibiotics regularly, we will not face the 99.9% risk of infection that we fear. Yet, I always communicate this to my patients. For example, you are arriving from far away, specifically from Antalya. Something has been troubling you. You might have a swelling in your ear, or a drop of pus like a pimple somewhere. In that case, you need to take pictures of your ear from the front, back, right, and left as if it's a passport photo and send them to us. We will look at the pictures. Mostly from the pictures, we can determine if there's a problem in the ear or any issues with the surgery. If we can't figure it out from the pictures, we can say, "Come on, let's see you in person," or have a video call. We can say to have a video call. So when you go, you shouldn't feel like you have no one. You must reach out to us regardless. If something is bothering you, you should ask. You shouldn't try to solve things on your own, because sometimes patients cause more harm when they try to handle things by themselves. In the worst case, if you send us a picture, we'll do our best to resolve any doubts. After the surgery, when we first open the ear, we will see swelling and redness. Bruising is rare, but let's say we do see bruising. These will pass within a week to 10 days. You inquired whether I should use the headband during the day while examining you. Yes. I explained that the purpose of using the headband in my technique is to avoid any involuntary movements that could harm your ear while you sleep, to avoid harming the surgery. That's why I say there's no need for daytime use, because even if you wear the headband for months, a poorly done surgery won't improve. The outcome will still be negative, so the headband won't improve the surgery. However, you are considering it from a visual perspective, thinking, "It looks bad, I need to cover it up, I need to hide it." Yes. A light hat can be worn, and a headband is also an option, but make sure it doesn't stay on for more than 24 hours to prevent any skin irritation. I also recommend airing it out occasionally, just like I explained inside. In our technique, we will use the headband while sleeping. Our goal is to avoid ear damage from involuntary movements while sleeping. Because you are still distant, our routine checkups will occur at 3 months, 6 months, and 1 year intervals, and you might not be able to attend in person. But we also experience these issues with overseas patients sometimes. If you think you can't make it for a checkup, please send us your photos at the times I mentioned, like 3 months later. You need to send us your photos after 3 months, 6 months, and 1 year so we can assess your situation from afar, even if it's not precise. If we notice any issues, we can advise you on how to proceed. Thus, we must not fail to maintain the controls, even if it is just with a picture. During your first year, as your physician, I will consistently invite you for checkups with other patients. After the first year, we will conclude your doctor visits. You will have a yearly visit with Ali teacher, Ali brother. You can call him Uncle Ali, and I will carve you. So you will make one big visit a year. You will ask how they are so that when you grow old, they will ask about you too. Greetings once more, friends. We finished Vaisel's right ear. Vaisel liked it very much. In fact, you can ask Vaisel for his opinion again, you know, the external voice. My instructor mentioned that while it appeared very close in photos and videos, it didn't look as close in person. And we moved on to shaping your second ear, the left ear. After forming the small leg of the Y letter in the left ear, we will now create the second leg of the Y letter, making this fold, this piece. We completed this step first, and now we will proceed with this one. The tail of the Y letter has no problems. We will proceed in this manner. On one side, we are still enjoying our music. Vaisel, are you getting bored? How are you doing?
The talk was lovely. The music is nice as well. Currently, my hand is okay. The surgery is great. Thank you. Is it as comfortable as you see in the videos? There's nothing to be afraid of, just like in the videos. I was a bit hesitant, but it goes very smoothly. I don't feel any pain at all. It was quite nice.
Yes, friends, now we are making the ear. At first glance you might wonder, this ear is so closely set, is this how an ear should look? It seems we are oblivious, but you appear to be quite knowledgeable. As a doctor who performs thousands of ear surgeries, friends, at the beginning we position the ear closer than necessary, taking into account its ability to expand. This ear will slowly open and stretch. Within 3 months, it will settle perfectly and take on the final, natural form we desire. Of course, we know that an ear like yours won't stay this close. But this ear won't remain this close either. There is room for stretching. Therefore, we kindly ask you to recognize that patience is necessary, dear followers. We communicate this to each of our patients. We inform every patient we treat and examine that the ear will be close at first, will slowly open, stretch, and will achieve its final shape in 3 months. We inform them that it will reach its natural state, its final form. Right, Vaisel? Okay. Hopefully, with our monitoring, we will observe that these ears have stretched, and we will achieve a more natural and finalized state. Keep watching us. Best wishes, Vaisel. Thank you very much. Alright.